here. I want to do a quick video on an interesting, albeit unexpected side effect of these gluten-free dieters out there. It's becoming just more apparent to me, and I'm sure a number of other practitioners that have a lot of people in their practice that perform or have a gluten-free lifestyle. A little story behind it first, and yes, I'm aware this is very anecdotal, so it doesn't mean a lot, but I think stories tell just that. They tell stories and get the point across. In my type of practice, I run several toxicity tests on patients for a variety of reasons, including heavy metals. Years ago, I noted a trend in a particular population of patient I work with, physique artists. They all had high arsenic levels. And after some research and digging, I found a correlation between their arsenic levels and the amount of rice they ate. So physique artists, in particular bodybuilders, limit grains, flour-based products, barley, and wheat. Rice is a primary staple in many people's diets, but it contains a large amount of arsenic. This includes rice cereal, rice flour, rice milk, rice pasta, etc. Rice has higher arsenic levels than other grains because it's grown in water. Arsenic is released into the environment through fertilizers and pesticides and then absorbed by the rice. I bring this up because last week I had 3 patients that I did toxicity tests on, and they all were incredibly high in arsenic. And after some digging with each of them, taking them a detailed history, they all had one thing in common. They were all on a gluten-free diet and had been for some time. The primary staple, since they didn't eat wheat products, rice products. And unbeknown to them, the fact that many gluten-free products actually use rice flour or rice syrup as replacement for the wheat. High levels of heavy metal toxicity can be related to cardiovascular disease, type 2 diabetes, neurological problems, and a few different cancers. Kids are at much greater risk than adults, so you parents who have children on a gluten-free diet, keep listening. If you choose to live a gluten-free lifestyle, you should limit the amount of rice you take in, especially brown rice, as that has more arsenic than even white rice. You should also probably limit the amount of gluten-free products out there because they use rice. If you do like rice, change your ratio of water to rice. Use a 6-to-1 ratio instead of a 2-to-1 ratio, water to rice, to cook it and then drain it. That gets roughly 30 to 40% of the arsenic out of it by doing that. And look for and utilize alternative flour such as almond flour, coconut flour when baking. Millet is a great alternative to rice. It has similar texture and look. Quinoa is probably one of my favorite because it's very low arsenic and it's high in protein and a great substitute. The most important fact that you can take home with this short video is the fact that no single health action, such as a gluten-free diet, in and of itself is of much benefit unless you view the big picture of health and apply it.